Good music, good friend. Good music, good friend. Welcome home.
95.9. Here we are once again, Mkaya. This is the moment that I have no doubt a lot of people have been looking forward to. Dr. Elna McIntosh, clinical sexologist and president of the Sub-Saharan Africa Society of Sexual Advisors, Educators, Researchers and Therapists. Welcome to the studio, Dr. Elna.
Thank you, Hector. And I've been looking forward to this moment. You know, I went and Googled you.
Ooh.
And I'm like, oh, that's nice. This is interesting.
Okay, you Googled me.
Yes,
All right.
I did. Because, you know, I'd also like to know who I'm talking to, you know, because sometimes people go, you know, the sexologist, and when I arrive, people say, where is she? You know, and I don't know what a sexologist is supposed to look like, but people are very disappointed when they meet me. I think I must be wearing a tiara and high heels. But no, thank you, and I'm so excited. And,
No, thank you very much.
And then my great friend, Dr. Jeeva, he was here last week, and he's here this week. We're doing a huge topic. So, Dr. Jeeva, thanks for coming back.
Thank you.
Welcome to the studio, Dr. Jeeva. But let's just look at my pictures on the internet. Could you just tell about my sexual world? Are you having those powers?
You know what? I looked at that and I thought, you know, metrosexual man, good style. Look how he's dressing. You know, no, I couldn't tell a thing because that is one. First, let me go back. I'm all over the place. Dr. Jeeva, did you bring my Ritalin with tonight? We spoke about Ritalin last week. When I was driving here, listening to your first show, which was on Christmas parties. Now, let me tell you, for me and Dr. Jeeva, this time of the year, we are very busy because Christmas parties bring out wonderful compulsive, impulsive behavior from people. So with alcohol, so we see a lot of sexual stuff that happens. And I'm told by Nashua or, you know, the photocopying people, they fix a lot of photocopiers at this time of the year. People are on top of the photocopier. They're having sex next to the photocopier. So it's an interesting thing. Yeah. So it's a very busy time for us. And I was thinking, oh, please don't stop your Christmas parties. It will put us out of business. See, we all feed off each other.
Okay, let's start it where it should start. Last week you looked at sex addiction, and we'll continue with this discussion tonight. But for those who might have missed the last week's conversation, like myself, do you want to just do a quick recap for us on what were some of the highlights, the things that we touched on, and then from there carry on. Dr. Elna, I'll just let you continue with Dr. Shabir Jeeva.
And you just jump in whenever you also have a burning question, and if people want to SMS us, phone us.
Oh, yes. You can use the SMS 33959. 33959. If you have any question, any comment around the subject tonight, sexual addiction, or maybe you want to call in and ask if you give us your profile and things you do, we could just tell you that now that's what we call a sex addiction. But first, that recap, Dr. Elna McIntosh.
All right. So, well, the lot of the questions that did come last week is, you know what, am I a sex addict? If I masturbate too much, if I'm on the website enough. So, Dr. Jeeva, you want to just recap on that for us?
Yeah, actually we had a lot of questions on masturbation, but I think today we'll just recoup last week, and we want to get out of that zone today. Otherwise we'll repeat last week and the questions will be the same. So firstly, we had the different forms of sexual addiction. We talked a little bit about pornography, 1, masturbation, 2, exhibitionism, 3, voyeurism, 4, fetishism, high-risk sex, prostitution, telephone and internal sex, internet sex, and lastly, multiple affairs and sexual encounters. That were the various forms. And we left that. And then we had various different association of we describe sexual addiction to be addicted to a chemical like neurotransmitter like dopamine, and I connected it to the psychiatric illnesses like obsessive compulsive behavior, narcissistic personality, manic depressive illness, and adult ADHD, attention deficit hyperactivity disorder, and that's where we went. And lastly, we ended up with a useful tool that they've loaded up on the website, a useful tool for self-assessment. There's 12 things, and it's right on the Kaya FM website. They've done an excellent job. So we'll get out of that today, and I hope that we're hoping to start and go on to sexual addiction and relationship today. That'd be one of the domains we'd like to cover, if that's okay with Elna and yourself.
Absolutely.
Okay, sexual addiction in relationships.
Yes.
Well, because for the partner, there's also a partner in this relationship, because I might be married, but my husband is off at the strip clubs, or my husband sits on the internet the whole night. And so I am not getting his affection because he is busy masturbating away, or he's on all these porn sites. So in my practice, that is what I would say. I sit with a desperate wife that says, I'm trying to fall pregnant, we're just not having sex because my husband's completely unavailable. And that's also not necessarily the case, hey, Dr. Jeeva?
No.
I mean, that man can be very active in his sex life with his partner and acting out.
Yeah, the thing is that what we were trying to clarify last week, that there is a chemical addiction, and the closest chemical that we could describe were the old-fashioned endorphins, which is the natural antidepressants. And last week we talked about dopamine, that is the pleasure center neurotransmitter that is low in ADHD and these other illnesses, and even noradrenaline. So these patients who have a sexual addiction are addicted to this chemical, and they get their buzz, they get their high, and they enjoy the feeling. So it's not the eventual orgasm, it's the chase to get to wherever they're going, and they get a high, they get connected, they feel great, and there's repeatedly either through pornography or through any sort of sexual, one of the different forms that we talked about, they enjoy it, they get a high, and they go look for that feeling again when they miss it and they yearn it. So if we can somehow increase the dopamine, this pleasure center neurotransmitter, chemically through medication. And one of the things, like in my field in adult ADHD, the Ritalins or the stimulants increase the dopamine and noradrenaline, so it gives them a similar feeling, although it is not addictive, and that is the same feeling. But what's the big difference about sexual addiction? Most people think, wow, what an exciting topic, we're going to have fun tonight. But these people have a lot of shame, regret, remorse and anxiety. It's not something they're proud about. It's not somebody that has sex all day and night and suddenly is showing off and happy. No, they are in the closet, they're hidden away. And so there is a great amount of shame, remorse and anxiety. The prevalence rate is about 3 to 6% of the world population. And strangely enough, about 20% of them are females. And when females go out to seek help, they don't get much help because many people don't believe them, and they have different perceptions, even caregivers, that they might be easy prey, or they don't know what they're talking about, and they have more difficulty than men. So these are some of the things Elna can tell us. She sees a lot of
well, I had
females.
wonderful emails this week after last week's show, and somebody said, I like sex a lot, so can't you hook me up with a woman that likes sex a lot too? And I was thinking, okay, so am I like a matchmaking club? So I also think that maybe it's exactly what you're saying. People are thinking, wow, this is wonderful. But by the time a patient comes to see us, they either have been caught out, and sometimes not once or twice. The wife has caught them out, or the husband's caught them out many times, or they've been arrested, or so that in itself goes hand in hand with the guilt.
Yes. And if you want a particular figures, the people are always interested in the air on percentages, but I could tell you some of the consequences, or percentage-wise, with sexual addiction. 70%, they had some severe relationship problems because of the sexual addiction. 40% had lost a partner somewhere along the line. 27% lost a career opportunity. 40% had experienced unwanted pregnancies, and that's very unfortunate. And 72% suffered suicidal obsession, and this is where we as psychiatrists come in, because we get our patients with anxiety, depression, and even remorse and suicidal. 17% had attempted suicide, at least one, and 68% had been exposed to sexually transmitted infections. So there's a high risk and consequence, and that's why it's closely linked to treatment medically and psychotherapeutically, psychologically. There's a lot of things happening, and we want to go into how it affects relationships, how Elna sees them in the office, how in certain cultures certain of our sexual addictive behaviors are taboo, and we want to clarify some of that stuff.
So I'd like us to go straight into those, how it affects relationships. But maybe I know we did do a little bit of a recap from last week. If we could just succinctly touch on what is sexual addiction? I think for me that would be a question that we can just, in very simple layman's terms, that this is, if you are doing blah, 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 then you know that you have a problem, you are a sex addict. Because somebody could say, if I'm married to my wife, or I have a partner and we do it every day, would you say that's
a sex addiction?
Sex addiction. Or maybe I want it every day, but she doesn't want it every day, or she wants it every day, I don't want it every day. Well, how do we define
sexual addiction?
Yes.
There's several definitions. One of them is there's the persistent and escalating pattern of increased sexual behavior, where the desire increases, or they quite increase in the obsessive level with the sexuality. That's just a general definition. When you take specific symptoms, which we went through last week, so we won't get questions on this, we'll just go through. They feel that their behavior is out of control. They are aware that there might be severe consequences to their behavior, but they still continue, like other addiction, like alcohol and drugs, right?
This, yes.
Food addiction is similar to that. And they have a feeling they are unable to stop their behavior despite knowing the consequences. So they are aware of the consequences, they just can't stop. And they're persistently pursuing destructive and high-risk activities. And they're wanting to stop or control what they're doing, and they take active steps to limit that, but usually they use sexual fantasies in coping with these feelings and situation. And they need more and more sexual activity to get the same high. That's like any addiction, we call it tolerance. Today you need 1 gram of 10 milligrams of Valium. In 6 months, for the same effect, you need 50 milligrams of Valium. Similarly in the sexual thing. And they experience intense mood swings around the sexual activity. And some of them end up spending a lot and engaging in spending money on all the sexual paraphernalia and in prostitution. And they neglect their social, occupational, and recreational responsibilities. So it's at a big cost. And very many times we get a patient from Elna's office. The wife's very upset, and she says she's got the husband on the internet with pornography, and she just wants to leave him, and she doesn't understand that this guy might have a chemical addiction to the dopamine, which is processed, which is internal. Other addictions like drug and alcohol are from outside, but the addiction from sexual is internal. That is the chemical. And so they come, she says, I don't want to be married anymore, and this is the end of it. And he says, give me a last chance, let's go sort it out. And Elna rightfully diagnoses it, saying, you're dependent to a chemical like dopamine, which is the pleasure center neurotransmitter, and this gets you all excited and happy, and this is lacking, and you're looking for more and more to get the same fix. So it is an illness, and several illnesses have it, and it can be treated. There are various different treatment modalities. Elna will tell us more. Okay. But psychiatrically, we use medication and things, and we block the marriage. We stop it. We say, no, this can be helped. Maybe not 100%, but they shouldn't be outcast at 100%. They should be helped. There is help, and it's a shame, guilt, and also a distraught condition. It's not something like running high and enjoying sex all the time. No, it's a very secret illness.